The Senate confirmation hearing for RFK Jr. as HHS Secretary has been contemptuous for several reasons. His Make America Healthy Again, (MAHA) initiative is a definite threat to Big Pharma and the status quo, with good reason. The U.S. spends the most of all developed countries on healthcare, but has not had a good return on its investment because of misplaced focus. The government and institutions like the FDA, CDC, NIH, AMA, and doctors have benefited from the public's trust that they are always noble and honest in their commitment to them. In my book, All Lives Matter, available at Amazon, Barnes & Noble, and Lulu, I argue about their susceptibility to the corrupting influence of the love of money, the root of all evil. William W. Thompson, Ph.D., a former senior scientist at the Centers for Disease Control and Prevention, CDC, as a whistleblower, gave a statement on May 6, 2015, expressing regret over the omission of statistically significant data in a 2004 study on the MMR vaccine and autism. He mentioned that the omitted data suggested an increased risk of autism in African American males who received the MMR vaccine before age 36 months. Thompson emphasized that vaccines are crucial for public health, but stressed the importance of transparency and proper communication of risks associated with vaccines. The whistleblower worked with Congressman Bill Posey, who introduced the finding and evidence of the cover-up to Congress in 2015, but nothing has been done about it. Here is Congressman Bill Posey's speech.
I rise today on matters of research and scientific integrity. To begin with, I am resolutely pro-vaccine. Advancements in medical immunization have saved countless lives and greatly benefited public health. That being said, it's troubling to me that in a recent Senate hearing on childhood vaccinations, it was never mentioned that our government has paid out over $3 billion through a vaccine injury compensation program for children who have been injured by vaccinations. Regardless of the subject matter, parents making decisions about their children's health deserve to have the best information available to them. They should be able to count on federal agencies to tell them the truth. For these reasons, I bring the following matter to the House floor. In August 2014, Dr. William Thompson, a senior scientist at the Centers for Disease Control and Prevention, worked with a whistleblower attorney to provide my office with documents related to a 2004 CDC study that examined the possibility of a relationship between mumps, measles, rubella vaccines, and autism. In a statement released in August 2014, Dr. Thompson stated, "I regret that my co-authors and I omitted statistically significant information in our 2004 article published in the Journal of Pediatrics." End quote. Mr. Speaker, I respectfully request the following excerpts from the statement written by Dr. Thompson be entered into the record. Now quoting Dr. Thompson. "My primary job duties while working in the immunization safety branch from 2000 to 2006 were to lead or co-lead 3 major vaccine safety studies. The MADDSP MMR Autism Cases Control Study was being carried out in response to the Wakefield Lancet study that suggested an association between the MMR vaccine and an autism-like health outcome. There were several major concerns among scientists and consumer advocates outside the CDC in the fall of 2000 regarding the execution of the Verstraeten study. One of the important goals that was determined up front in the spring of 2001 before any of these studies started was to have all 3 protocols vetted outside the CDC prior to the start of the analyses so that consumer advocates could not claim that we were presenting analyses that suited our own goals and biases. We hypothesized that if we found statistically significant effects at either 18 or 36-month thresholds, we would conclude that vaccinating children early with MMR vaccine could lead to autism-like characteristics or features. We all met and finalized the study protocol and analysis plan. The goal was to not deviate from the analysis plan to avoid the debacle that occurred with the Verstraeten thimerosal study published in Pediatrics in 2003. At the September 5th meeting, we discussed in detail how to code race for both the sample and the birth certificate sample. At the bottom of Table 7, it also shows that for the non-birth certificate sample, the adjusted race effect statistical significance was huge. All the authors and I met and decided sometime between August and September '02 not to report any race effects for the paper. Sometime soon after the meeting, we decided to exclude reporting any race effects. The co-authors scheduled a meeting to destroy documents related to the study. The remaining 4 co-authors all met and brought a big garbage can into the meeting room and reviewed and went through all the hard copy documents that we had thought we should discard and put them in a huge garbage can. However, because I assumed it was illegal and would violate both FOIA and DOJ requests, I kept hard copies of all documents in my office, and I retained all associated computer files. I believe we intentionally withheld controversial findings from the final draft of the pediatrics paper. End of quote of the doctor. Mr. Speaker, I believe it's our duty to ensure that the documents Dr. Thompson provided are not ignored. Therefore, I will provide them to members of Congress and the House committees upon request. Considering the nature of the whistleblower's documents, as well as the involvement of the CDC, a hearing and a thorough investigation is warranted. So I ask, Mr. Speaker, I beg, I implore my colleagues on the appropriations committees to please take such action. Thank you, Mr. Speaker. I yield back.
The implications of this discovery are profound, raising questions about vaccine safety and public trust. In light of Dr. Fauci's preemptive pardon by former President Biden, it is reasonable to ask, what else has the government, FDA, etc., been lying to the American public about? Many believe the appointment of RFK Jr. as HHS Secretary will be a great start to efforts to restore faith in science and those responsible for the health of the American people. Stay informed and vigilant as we navigate these challenging times where truth and trust are paramount.